Angela, you're on silent.
Oh, hi everybody. Sorry for that technical difficulty. Welcome again to our Global Health Pathways series. Today's presentation is being on your career options. We have a really exciting lineup of 3 panelists to share their experience being part of the global health field. Before we get started, I'd like to do a quick introduction to both the Faces for the Future program, as well as our partner in this series, Global Health Fellows Program 2. Faces for the Future is a national nonprofit organization that creates high school pathway programs for youth going into careers in healthcare, public health, and behavioral health. Global Health Fellows Program 2 is the U.S. Agency for International Development, USAID's fellowship program that finds and supports diverse professionals at all levels. A couple reminders before we begin. If you have any questions during the webinar, please use the questions function in your control panel. We'll be keeping track of everyone's questions and then answering them during the Q&A section. For those of you who are hosting a watch party, program coordinators, teachers, if you can gather your questions from your students and then use, again, the question feature, and then we'll answer them during the Q&A. Also, this webinar will be recorded and sent out to everyone who registered. So we're just going to do a quick overview where we will do a recap. Then the panelists will talk about their personal backgrounds, going into the global health field, then highlights of their career as well as challenges, and then finally advice for everybody at each education level, high school, undergraduate, graduate, and then seasoned professionals. And then we will do our Q&A and conclusion. So one last thing before I introduce our panelists. For those of you who missed out, we're going to do a quick recap of our last 2 webinars. So in our first webinar, Global Health Pathways, Your Toolkit, we talked about the competencies or skills that we found make the most successful global health worker, such as cultural competency, creative problem solving, knowledge management, interpersonal skills, and managing limited resources. Cesar Barrios Wilson, a former Peace Corps member, spoke on all these skill sets and how she utilized them in the field. In our second webinar, Global Health Pathways, Your Stepping Stones, we talked about education and practical overseas experience. Josie Ramos was our guest speaker, where she talked about growing up as a Latina, facing a lot of issues that minority students face when entering this field. We called these the big 3 F's: family, fear, and funding. So both of these webinars are actually available on our YouTube site, and I encourage you to watch them, especially if you enjoy today's webinar. So finally, we're going to introduce our panelists, and I'm going to ask them to turn on their cameras. Yay, okay. So first up is Sylvie Rousseau, who is joining us from Haiti.
Hi, everybody.
And then, oh, sorry, go ahead.
That's good.
And then we have Temtayo Ifafore joining us from Washington, D.C.
Hello.
And then lastly, Dr. Michael DeRosa coming in local from Oakland.
Hi, everybody.
And then we can go ahead and go down the line, starting with Sylvie, and just talking about briefly what you do currently.
Sure, thanks for having me, Angela. My current role is the Monitoring and Evaluation Officer for the CARES Foundation in Haiti. Our program focuses on orphans and vulnerable children and their issues surrounding HIV/AIDS. My responsibilities include data quality for the whole country. I lead the company choir, and I also do whatever else comes up.
Go ahead, Timmy.
Great. Hi, I'm Timmy. I am a health workforce advisor with USAID under the Global Health Fellows Program. Just to give you a little bit of a snapshot of what that means is I help look at all of and manage USAID's funding and all of its portfolio that it gives to other countries to help them figure out what to do with their health workers. So what this means is it's everything from how many workers do we need? How many people are in school? How many people are going to graduate? Where are they in the country? Making sure that countries can keep the workers that they produce and that they have different benefits packages to keep them in the country so that they don't leave and go to other countries. And then everything up into what they do when they retire. So we try to look at the whole workforce from when they're in high school at the beginning, like you, and helping them to find careers within healthcare, all the way to the end of their careers when they retire. All right, so look forward to talking to you more.
And then go ahead, Dr. DeRosa.
I run the physician assistant training program at Samuel Merritt University in Oakland, California. I'm a practicing PA in family practice here in Oakland. And as part of my role here, I annually, actually a couple times annually lead trips to Panama with students and faculty from Samuel Merritt, and we provide healthcare in a rural environment with the indigenous population down there.
Awesome. Thank you so much again, all three of you, for joining us for this webinar. We're going to go ahead and go into personal backgrounds, and we're going to start with Sylvie Roussel.
Okay, thanks, Angela. So I'd like to tell you about my path toward global health. It wasn't exactly straight. I was kind of doing a lot of different things before I landed my first great global health job. But it's always been what I knew I would pursue. So I was always interested in a lot of different cultures, a lot of different countries. I always knew I wanted to travel. And so I knew that because of this interest and my interest in health and healthcare and health systems, that global health would be where I would end up in one way or another. For me, I actually studied international development and global health in college, so I was lucky enough to be able to create my own major and choose the classes that I wanted to kind of support my interest in this field. I heard about global health as a profession when I actually went to my orientation session, or my first couple of days of college. So it was a really great starting point, and I got to kind of plan my whole academic career around that. I was able to take advantage of study abroad and a couple of service learning trips during the course of my 4 years. And then afterward, I spent some time teaching. I spent some time with the Global Health Fellows program, where Timmy actually is, and I was doing admin and support work for that organization. And then the way I found my path to my current job is at a cousin's wedding. I was talking to somebody, and she said, "Hey, you know, you're interesting to line up with what my organization is doing. Why don't you come to Haiti and work with us?" So a lot of luck happened, but also a lot of preparation, because I had spent a lot of time learning about what there was in the field of global health and kind of narrowing down my interests. I chose this specific field because I love technology and data. So monitoring and evaluation is a lot of statistics and like figuring out where the data is coming from, how we handle it, and how it helps us improve our programs. So measuring the effectiveness of our interventions is really what I do. And it's a combination of taking all that data and working with the people who are making the programs happen so that they can use the data. So not only do I like technology, but I also like the human aspect and the organizational implementation aspect of that. My first trip abroad was actually to the Philippines. I am a child of immigrants, so I immediately went to the Philippines when I was born, and I spent some time there and in Haiti because my father's from here. So I think that those formative experiences of having parents from different countries really helped to direct my interest toward international development. I think the language skill that I got from my parents, and then their adaptability toward all the different challenges in the US, was really one of the formative skill sets that I've gotten. And if we can go to the photo slide, please. This is a picture of me working in Uganda. Actually, this was when I was with the Global Health Fellows program. I was doing communications. So I never really studied communications, but I took some classes that really helped train me for that. And I was able to use my interest in global health and my skill in communications to do this, this site visit trip to Uganda with my last job. So it was a great opportunity. Thanks.
Thank you so much, Sylvie. Now we have Timmy.
Hi. Great. So my path also, like Sylvie's, was also not a straight path. One of the things that ended up being the biggest challenge for me was figuring out that I wanted to do global health. I didn't have the option. I didn't know that global health was a field. When I was in high school, I thought I wanted to be a doctor. When I went to college, I said I'm going to be pre-med. And 3 years into it, in my junior year, I realized that I didn't want to do medicine, but I had no idea what else to do. I found out about public health through one of my mentors and one of my advisors, and he said, hey, I don't know what it is, but I think you're interested in public health. So that's how I discovered public health. And pretty much all that I knew was that I loved traveling and I loved healthcare. And so as soon as I learned more about public health and knew that global health was an option for me, because it helped me to figure out an option or an opportunity to travel, I pursued opportunities to travel. When I was in high school, one of the best things that I was able to do was do a homestay program, living with a family. As Sylvie said, learning a different language is really helpful. If you already speak one, that's great. If you don't, you can learn now. There's a lot of different resources out there. And so, as I said, I learned about global health my junior year at Yale University. And after that, I decided that that was what I wanted to do. So I later on I got a master's in public health, in healthcare administration. And in between the time where I figured that out and now, I've been to over 35 countries. Traveling is one of the most important things for me, and I actually was just out of the country and got back yesterday. So that's how much I love to travel. The things that I've realized have been the most important to me is there's constantly going to be a need for people to write. In global health, we're always looking for ways to document our stories, document our impact. So writing and communicating is one of the most important skills that I've noticed. The other thing, as Sylvie said, is really that cultural ability to listen, understand that people are coming from not only different experiences than you are, but different countries, different cultures, and kind of being respectful of that culture, of other cultures, is really important. Of course, you can't go into public health or global health without knowing public health itself, so that's definitely one of the skills. I think people are constantly looking for those who understand the health arena. They're looking for those who understand what's happening outside of their home country and what's happening around the world. So keeping up to date with what's happening is something that I found is really important. And because a lot of our work involves working on teams, I found that learning how to do teamwork and be collaborative is one of the other skills. If you don't mind advancing to the next picture, I'll talk to you a little bit about this experience. So this is a picture of me in Nepal, where I'm visiting one of my mentees. He actually is the guy wearing stripes. His name is Marvin Gomez, and he's from the Bay Area. He grew up in Southern California, ended up going to Riverside, and was the only one of his friends who wanted to travel overseas. His family's originally from El Salvador. I gave him lots of advice, and I said, hey, you might want to think about the Peace Corps. He applied. I helped him write a recommendation. And a year later, he was off to Nepal, learning how to speak Nepali and living with a Nepali family. So the people that you see in the picture is his family from Nepal, along with his other Peace Corps volunteers. So I just want to let you know that there's a lot of different ways for people to get into global health and into international health, and I look forward to sharing a little bit more about those resources later. Thank you.
Thank you so much, Timmy. And then now we're going to move on to Michael, Rosa.
Hi there. Yeah, I think kind of like the two other speakers, PA as well as kind of global health work are areas or fields that people often come to in kind of a tortured path. Um, I got out of college and I got a doctorate in neuroscience. I did a couple of postdocs and then decided I wanted to get into teaching, and I got a job here at Samuel Merritt University. Samuel Merritt is a health science university, so we train PTs, PAs, nurses, occupational therapists, podiatrists, etc. And it soon became sort of advantageous to become a PA myself, and I was able to go back to school. And at the same time I got my PA training, I got a master's in public health, which sort of, I think, expanded my perspective, and certainly already had an impact on my teaching. My first experience with global health happened right after I came back to Samuel Merritt. I joined a team of folks from Samuel Merritt and led a trip to Panama. And now I've been there about a dozen times. We've taken over 300 students from Samuel Merritt, not just the PA program, nurses, podiatry students, occupational therapy students, PT students, and interprofessional teams of faculty as well. And we go to a rural area in the central part of Panama, up in the mountains, and work with an indigenous population there. And so now we go twice a year, and we'll be back in April. Why did I choose the field? PA kind of came to me. Like I said, I was teaching here at Samuel Merritt before I went back and became a PA, but it's given me enormous opportunities, not only to improve my teaching, but to be a healthcare provider and to practice medicine and do family medicine. And the public health training I got at the same time kind of led directly to working in global health and trying to provide care outside the United States as well. In terms of competencies and skills, for me, practicing medicine in an under-resourced environment is this enormous challenge, and it can be a lot of fun to try to figure out what you're going to do when you can't get that lab or X-ray or what have you, and your treatment options are limited. It demands a resourcefulness, and certainly working in an underserved environment or in a under-resourced environment, whether it's a first world or close to first world country like Panama that has some very impoverished areas within it, or the most remote place that just requires a lot of flexibility. So I think flexibility and resourcefulness are two of the skills that have been super important, and don't necessarily come easily. This is the team of folks, PA students, was on the last, actually the trip last April, second last trip to Panama. And this just gives you a kind of a good example of the remoteness of the region that we go to. We're high up in the central Panamanian mountains, working on what is essentially their version of a reservation with indigenous populations up there. And I think I have pictures further into the presentation that will kind of show you the population and where we work.
Awesome. Now we're going to go into highlights, starting with Sylvie.
Hi again, everybody. So what is my favorite experience while being in global health? I had listed here a specific incident that just happened. You may have heard in the news about Hurricane Matthew that happened in Haiti. Our little island is very, very mountainous, and when those hurricane winds were whipping around, my city where I live was protected by those mountains, but a large part of the southern swath of Haiti was really pretty badly beaten up. Crops were destroyed, people's houses were completely damaged, and mostly it was roofs that came off. In all of that, roads got cut off, and even though my organization focuses on HIV/AIDS among orphans and vulnerable children, we are actually able to adapt to the needs of any given moment. So my organization, the day after the hurricane, actually sent out 2 teams. One I led to Kai, a city in the south, and another to Jérémy, to assess the damage at some of our sites in those cities. And they we didn't have necessarily a, a specific plan, but we knew that we had to act because people and our patients had been hurt and their food supplies were being cut off. So we just acted. And when we saw what was on the ground, we got some partners together, and I was able to volunteer and support our field hospital that we operated in Jérémy for about 3 weeks. So this was a hospital that responded to those immediate injuries, worsening infections, and needs for clean water and food in that region. And this experience was not something I anticipated at all. So I arrived in Haiti in August, and the hurricane happened in October. And in that time, I had been doing a lot of desk work, a lot of number crunching, and kind of figuring out what the whole organization was about. And then suddenly, there was this big need. So the organization was looking for volunteers to go to that region, and I raised my hand and said that I would go. So that just opportunity opened up and presented itself, and I actually was able to design some data and monitoring systems in the field hospital so that our doctors who were volunteering and all of the support staff could do their work more efficiently. And I was really proud of the long hours that we put in. We were up before 5 every day, and the patients were coming in by 5:30, and they would leave also at 5 p.m. So it was a very difficult situation because there was no water, there was no electricity, because all the systems had been taken out by the hurricane. Some of those things are coming back, but at that time we were able to see over 300 patients a day in that little clinic, and it was really an amazing opportunity to participate in something that was rapid reaction, and that really met the immediate needs of a population. So I was really proud to be able to join in that effort, and it wouldn't have happened had I not raised my hand that one day and just gone for it and just volunteered. I didn't know what they were going to be asking of me. I just knew that they needed extra hands on the ground, so I went. So that is my story about Hurricane Matthew and Jérémy. We're still doing reconstruction efforts in that zone and trying to work there, but this picture shows another of my favorite global health experiences, and this was when I was in college. I took a trip to the Philippines, and we are focusing on gastrointestinal worms in a slum in Cebu city area, and it was a lot of fun, working with kids on preventing and treating worms. But the biggest thing that I thought was very gratifying from that experience was the fact that we were mentoring high school students. So as a college student, I was helping high school students from Cebu City develop their leadership skills and provide services and a program in their community. So I felt like even if my work was short-term, it was a 2-week project, that the impact that I had on helping these high school students develop their leadership would live long after I had left the country. So thanks.
Thank you so much, Sylvie. Now we're going to go ahead and go on to Timmy.
Great. So I'm just going to tell you a little bit about my favorite global health experience from the past few years. As you know, recently Ebola hit West Africa, mostly Liberia, Sierra Leone, and Guinea. Mind you, this is not the first time Ebola has been on the scene. It's actually, there have been other Ebola outbreaks, mostly in East Africa and Uganda, but this was the first time where they were estimating that if it was not controlled, that it would have huge, huge ramifications and really impact the world globally. One of the reasons and one of the opportunities that I had, I think in global health, one of the big challenges is we're working on big problems. We're working on poverty. We're working on things that are really huge and really difficult for any one person to tackle. And huge part of global health is that sometimes it's hard to see an impact in a short amount of time. And I'll talk about that later during the challenges. And so when Ebola came up, they were also looking for volunteers and for people to go. And because of my background in health workforce and because I was actually trained and I used to be a hospital manager, they asked me to lead a team of 4 people to help us to coordinate. They said, hey, there's a huge problem out there. We have a number of government agencies who can all help. And instead of each person doing something individually, how about you coordinate and come up with a program for what we can do to help the health workers in Liberia, Guinea, and Sierra Leone. One of the biggest challenges was that health workers were being attacked because people felt there's a lot of misinformation about Ebola. People thought that health workers were the one bringing it to people. So there were attacks on health workers, there were attacks on hospitals. And so health workers weren't showing up. And what that meant was that if you had a normal health issue, or say you were a mother who was going into labor, you'd go to a health facility and there'd be no one there. So part of my effort and part of what we did was help. We went to Liberia. You can go to the next page, the photo. So we went to Liberia and went to the Ebola treatment unit, which is where when anybody was suspected with Ebola, they'd send them. The people that you see and the workers in blue were all part of the front line. These were not heroes. These are people who every day just decided that they were going to show up. And we went to the field, we heard their stories, we listened to them. And then one of the moments that I'm most proud of, and one of the reasons why this is my favorite experience, was I was able to coordinate with a team of people from a number of different agencies, and we were able to mobilize over $20 million to help Liberia over 5 years. And without us coordinating, and the way that we did it, we said, you know what? One agency, you're going to work on nurses. Another agency, you're going to work on doctors. So the thing that I loved about this was, one, we were able to be efficient. Two, we really were able to go and listen to the voices of the workers who are going to work every day, hear what their needs were, and design a program around that. And knowing that I was part of an initiative that not only helped make sure that we could be more effective with our money, but also make sure that we were designing a program that took health workers into account and that we would be able to save lives, is one of the most valuable experiences that I've had in the past few years. And so this is one of my favorite favorite things that I did. And yeah, thank you.
Thank you so much, Timmy. We're going to go ahead and move last to Dr. DeRosa.
Hello. I think that the way I answered this question about my favorite experience about being global health is comes from the fact that now that I've been to Panama 12 times and kind of had my initial experience with global health and the region that we work in, the thing that I take from it every time I go now is seeing how the students are changed and the way in which they carried back the experience to their work in the United States. A number of them have come back on future trips and are getting more involved in the kind of planning and organization of our efforts down there. And then I think the other thing I would say about it has been a really rewarding experience is we've now gotten to the place where we're starting to create a sustainable presence and a relationship in one place in Panama, to the extent that the community there has now offered us an opportunity to try to build. And so we're now moving into a phase of this experience where we're looking at ways in which we can build a structure in the community that we can use, and I think will really move the focus of what we do from healthcare to more public health efforts, addressing things like water quality and stoves and that sort of thing. This I just threw in. So this is one of the Nave girls. The community that we work with is called the Nave people. I guess an indigenous group in the Panamanian mountains in central Panama. And the building in the background is a school that we kind of take over for the week that we're there. And we use the schoolrooms to produce our clinic. And if you flip up to the next slide. Angela, can you go to the next slide?
Sorry, that photo is not included.
Oh, okay. Sorry. Never mind. So the next slide was just going to be one of the Nabe women in their dress attire and the way that they kind of carry things. There's a lot of physical labor there, kind of a subsistence existence. So we deal with a lot of the effects of their lifestyle that where we're doing kind of more medical interventions, the public health background and the public health sort of emphasis going forward, we hope will kind of bring to bear to try to address some of the things that make their lives hard and that diminish the health of the community, like I mentioned, water and smoke exposure, and addressing some of the musculoskeletal impacts that we see of their very physical existence.
Thank you, Dr. DeRosa. Now we're going to go back to Sylvie, and we're going to begin discussing challenges.
Thanks. So one of the challenges I faced while pursuing the global health field, I think that this is maybe something that people can relate to, but throughout my undergrad, I found it kind of difficult. You know, it kind of is hard, this whole college thing. And I had some lapses in confidence during that time. You know, 4 years, it may seem like a long time while you're in it, but it goes by really fast. And it was really an opportunity for me to look at my strengths and my weaknesses and figure out where I wanted to put more effort. So it took a long time for me to really, you know, I knew that I wanted to do global health, but did I think that I could do it? That was the issue. So it took a lot of conversations and a lot of just trying it out for me to really think that I had a shot in this field. And, you know, I knew that I was a smart kid. I knew that I had, you know, certain skills, but how could I find my way into an opportunity that would let me use those skills? One thing that really helped was just my first job in global health, which was not exactly doing health work. And I think a lot of people are going to find this, that you know, there are a lot of different roles that people can have. I met yesterday 3 different people from USAID, and one was a businessman. He had his MBA, Master's in Business Administration. Another one was like an electrical engineer. Another one was an infrastructure engineer. So there were people in my first job with the Global Health Fellows program that I met and I talked to that inspired me, because they showed me that you don't have to, you know, you don't have to be a certain kind of thing. You just have to have skills and be willing to put them into practice. So just all the different conversations that I've had over the years and the different examples that I've seen have really boosted my confidence in myself, as well as just trying it out. So before doing my current job, which is monitoring and evaluation, I had never done monitoring and evaluation. I didn't know that I could do it. I was encouraged by some friends, and I jumped in, and it turns out that, hey, you know, I can learn almost anything if I really set my mind to it, including, you know, programming and different kinds of math. And I think just the way that I've found to overcome my lack of confidence in different areas is really relying on my network, my friends and family, and just trying it out, and not letting my setbacks and my failures, you know, set me off my course. I knew that I wanted to do something, so I kept going, and now I'm going to still keep going. It's not going to be easy, but I'm really happy with the progress that I've made. In Haiti, one of the challenges that I face today is learning how to work with different kinds of technical staff. So I mentioned that there are people in this industry from all different backgrounds. I work with a lot of IT programmers, and I'm trying to figure out still how to interact with them and how to inspire them and lead them and work with them to get big projects done. I also work with a lot of nurses, and that's another skill set that I have to learn how to communicate with. Also, in Haiti, it's a former French colony, so keeping that cultural background and the history in mind is really interesting because, you know, I've never been in, I always worked in the United States in my professional career, but now I'm working in a place with this French background, and I don't know whether I need to use the formal you or the informal you sometimes. I don't know whether it's appropriate to like kiss your colleagues on the cheek, but I'm learning and you know, just coming from an attitude of cultural respect and asking a lot of questions has really helped me to navigate those cultural differences. And when you're in a place where, you know, you come from a country where there is a lot of money, you know, whether or not you believe that the U.S. is a lot richer than a lot of other countries, and so people look at you a little bit differently when you come from that background, and just being aware of that and not, you know, being aware of how you talk to people and how you, you know, how you navigate those differences in like class and background, socioeconomic status. That's a really, really difficult and important but ongoing challenge that I'm facing. If we can go to the next slide. Yeah,
sorry, there's no pictures for the rest of the series.
Oh, okay. No worries. Well, then we can go ahead and move on. Thanks.
Great. In terms of the challenges that I wanted to talk about, I mentioned this a little bit earlier that global health is really hard and it's really big and you're addressing a lot of issues. I also will second what Sylvie said, which is, for me, it was really difficult to also find that first opportunity to go overseas. I talked to a lot of people. One of my mentors, he advised me to talk to as many people as I could who were doing global health and find out their stories. And all of the people I spoke to, one, I realized that not a lot of people look like me, so there weren't a lot of people of color who were doing global health at that time. But then a lot of them had volunteered, and I said, well, I grew up in New York, I'm from the Bronx, and I said, listen, I can't afford to volunteer my time in order to go overseas to help. Like, this doesn't make sense. And so it actually took me a little bit longer. And for the first few times, for example, my first overseas experience was when I was in high school, where I got to do a homestay program in Mexico. And I was able to do that because I wrote to them and said, hey, do you have a scholarship? They didn't have scholarships posted on their website, but the exchange program offered me a scholarship. In college, I looked for any opportunity during the summers or during any of the breaks for programs that would pay for people to go overseas. And so in college, I was able to go over to Brazil. And afterwards, I just, you know, kept looking for jobs that would allow me to go overseas or opportunities to volunteer. But it did take a little bit of extra work on my end to be able to fundraise because, as I said, a lot of people first get into global work or global health through volunteering. One of the biggest challenges that I face today, so now that I've traveled to a lot of countries, now that I work for a program that includes a lot of travel as within global health, the biggest challenge that's starting to come up is issues of security. And by that, I mean physical security. Your family is going to worry a lot about you. They're going to wonder, how come you can't call them? How come you're not in touch? Why are you not sending them an email to let them know you've arrived? And so the world has changed, and it's sometimes just not as, it's a little risky. And so I think for me today, with the considerations of things happening globally, that sometimes people who are from the United States get targeted, you realize that you might have to be selective in the places that you go. But outside of that, I still feel really optimistic and hopeful and really happy about the career and the choices that I've made in global health. That's it.
Thank you, Timmy. And lastly, Dr. DeRosa.
Thanks, Angela. So One of the biggest challenges that I have faced in trying to get involved in global health work and still face in certain areas is that the PA profession is really an American profession. While people in other places understand what a nurse is, they understand what a doctor is, they don't necessarily understand what a PA is. So we have to spend a little extra time talking about PAs and what they do and so on. And that can be a challenge. Obviously, it can be limiting. Um, Funding and resources are always a challenge in this kind of work, and so that's no different where we go. Panama is nice because it is a fairly well-resourced country. It's one of the wealthiest countries in Central America. The problem there, though, is that the wealth is really kind of concentrated in Panama City, and the rural areas outside of that don't get the benefit of it. So I look at a lot of what we do as trying to redistribute resources and try to get resources to people who need them. And then I would dovetail on what the other presenters said about language. We face the added language barrier of working with an indigenous population that many of which still speak indigenous languages. So it's not even enough for folks on the trip to speak Spanish. We end up translating into one of the indigenous languages while we're down there, and obviously that presents all sorts of unique challenges to the work we do down there.
Thank you, Dr. DeRosa. And now we're going to go into our final section where we're going to be talking about advice from our panelists to our audience.
So I am kind of early in my career still, and I am really looking forward to the advice from the other two panelists who are a couple of steps ahead of me. But I talked to my high school age sister and try to think up some good advice for you all. I think one of the biggest things is that when you are, in high school or an undergraduate, you have a lot of information, but there's a lot of practical stuff that's hard to know unless you're doing it. So the best advice that I can give is to ask a ton of questions and don't stop asking questions. You're gonna try to connect with somebody who's doing what you want to be doing or what you see yourself doing. I think that when you are able to appreciate the work that somebody does, they will appreciate you for appreciating them. So that creates, just being open and respectful and curious can help you create bonds with different people who can feed you, that key information, those key insights about when to apply, what kind of, opportunities are available, how to submit a resume, and how you want to create your study plan. So you can never ask enough questions, I think, and even now I spend a lot of my day asking questions so I can better do my job. So at the high school stage and at the undergraduate stage, you just need to keep gathering as much information and take advantage of the people who might be around you that can feed you that information. At the undergraduate level and in maybe grad school, there are a lot of opportunities. I think that it's really important to be aware of the things that are going on around you. Sign up for mailing lists. You can filter your email and you can put things in junk, but if you never start gathering the information, you won't have any place to start. So take advantage of all the different opportunities that that come your way in college and in grad school. And not only that, but you have to kind of make your own opportunities. So Timmy was saying that she asked for a scholarship. I thought that was really impressive. There are often resources even beyond what is listed. It's kind of like bargaining. You have to ask for X and then you can get maybe Y. I think it's each person's individual responsibility to figure out what they want and then kind of make it happen. And on that point, you do have to know what you want. So find a focus and find something that inspires you and pursue it with abandon. Um, it's, it's going to happen that you're going to change your focus from time to time. But if you see something that's interesting to you, don't get distracted by those many other millions of opportunities. But kind of find a goal and work toward that goal. At the young professional level, I think that myself as a young professional, I'm trying to establish my credentials. I'm trying to figure out my professional identity, and that's hard work. And I think maybe when you get your first job or your second job, you might like breathe a sigh of relief. All the previous work that you've done has landed you where you want to be. But I don't think that's enough. I think you really have to continue working hard, take classes online, take classes at your local community college, and continue to become an expert so that you have confidence in the knowledge and the opinions that you have, but also don't get too cocky. As you become an expert, as you're kind of climbing into those next levels, don't forget to take that high schooler advice and continue to ask questions. And then my advice for seasoned professionals, talking to leaders of organizations. I think what I've seen sometimes as the problem is that there's so much complexity when you're leading an organization, especially when it's an international organization or doing international work. There's so much complexity and so many different people you have to manage. It's a lot of politics. It's a lot of kind of strategic moves and planning. But I think one thing that can get lost in all of that is the overall mission. So I think working hard to continue to stay focused on that mission as an organizational leader and be aware of the working styles and the personality styles of the people around you can really help you do the best work and bring your organization to the next level. And that is what I have in terms of advice. Thank you.
Thank you so much, Sylvie. Next, we're going to go on to, again, Timmy.
Great. So everything that I'm going to talk about is ways for you to hack and figure out how to get into healthcare, global health, without having to spend all of your personal money. So the first thing I mentioned is if you're a high school student, one of the biggest things that you can do is do a homestay. You can do a volunteer trip, or you can go visit family. You can go visit friends of family. If you have a friend or a neighbor who's from a different country and they're going home for the summer, then you can work for one summer and then the next summer go and visit them. I listed 2 organizations that did homestays. One is called American Field Service USA, and one is called The Experiment, which is the Experiment in International Living. And these are both organizations that I did. I went to Mexico with The Experiment, and I went to Costa Rica with American Field Service. And both of those are organizations that I was able to get some type of scholarship from. And then because I got this scholarship, I was able to go and ask my family for donations. And I was able to raise $500 from my family, which I used as spending money. So it wasn't a lot, but at least it's better than having to pay for it myself. If you're currently in college, then one of the big things I would say is for undergrads, there are so many opportunities for your international work to get funded. You can do also exchange programs. You can work with professors and see if you can get a research grant. You can try to volunteer for the Peace Corps, which also does pay you. They do pay you based on local wages. They provide housing. And then you can get, when you come back, they do give you a stipend. Or, you know what, if there isn't anybody doing what you want to do in global health, then you can start your own organization and start your own volunteer trip. You can do a GoFundMe. You can do a whole host of things. And so I want you to know that there's a lot of different ways to get involved in global health. And if you're in college and you're trying to figure it out, the third option is to work for an organization based in the United States that works with that works overseas. That will also start to introduce you to global health, even if you don't have a chance to get on a plane and travel. If you're a young professional, that's the same advice that holds. There's a lot of organizations. Remember, global health isn't just about working overseas, but getting yourself experienced and exposed to different cultures. And so if you have the opportunity, whether or not it's through a church group, through vacation, through a friend, through volunteering to help and at least get exposed to other cultures, then that's a way. Of course, if you're a young professional or an undergrad or in high school, I know that a lot of times learning another language seems like a pain, especially if languages come difficult to you. But learning other languages is another way to kind of expose you to other cultures and people who can speak other languages are in high demand. If you're a seasoned professional, you'll know where to look. I recommend the Foreign Service. That's one of the ways that, especially as an experienced person or an experienced expert, that you can go and you work for the U.S. government and you get to have a lot of postings overseas. But there are a number of organizations that allow you for the opportunity to be an expert overseas. I agree with Sylvie. Getting mentors at every step of the way is what you have to do. Find one person that's doing something that you want or at least having a lifestyle that you're interested in. Interview them, talk to them, ask them for introductions to other people. The more people you know, the more opportunities are going to come. And tell everybody, if you really want to do global health, then the first thing you say to anyone when they ask you, what do you want to do with yourself or what do you want to be, tell them you want to work in global health. You never know where that first opportunity is going to come. As Sylvie said, she was able to get this opportunity by talking to someone at a family event. So you just really never know. And so just put yourself out there and take that first step and at least communicate to everyone around you what your intention is. And if your intention is to work in global health, then that's the easiest thing you can do. All right, I'll stop there.
Thank you so much, Timmy. And then lastly, Dr. DeRosa.
So I think you'll see some overlap, I hope, in what the other presenters have said and what I'm going to say. The first thing I thought of for high school students as advice is to practice awareness. Global health is about what's going on in the world, and you're not really going to know where to jump in or know what you're interested in doing if you're not aware of that. And so I think for high school students, sometimes it's a harder thing. You get real focused on your local environment, on your school environment, and your friends, and your local community. And it might not be completely obvious to you where to get information about the broader world. So make it a habit, make it a practice of being well informed about what's going on in the world and where the hotspots are and where the issues are. And that will inform what you want to do at later stages. For undergraduates, public health and global health are really varied fields, and there's a lot of opportunities to do a lot of different kinds of work. So I think it's imperative at that level to find something that you love and that you're passionate about, that's going to make you want to go back to school every day and want to get involved in that work. And that's going to help to drive you, because while it does kind of have a glamour to it to talk about all the travel and all the different places in the world and so on, it's not easy work. The travel is hard. The environments that you live in sometimes are really challenging and uncomfortable. If you're not passionate about what you're doing, it's going to be that much harder to do. So pursue something that you're really passionate about is my advice for undergrads, and find a way to be able to continue doing that work and do all the things that Timmy and Sylvie talked about to make that path for yourself. For young professionals, advocate. Be aware of the political process. I think we're at a point where the kind of traditional model of global health work of non-governmental organizations working in some corner of the world doing a project that nobody's aware of isn't enough anymore. It's not going to be enough to address the world's big problems. Things like climate change, the Ebola epidemic is a great example. These are huge problems that really require the input of resources and personnel, oftentimes from governments as well as organizations. So understanding and being involved in the political process, I think, is going to be more and more essential to global health work. And then I left off the seasoned professionals one, but I think what I would add for that is to mentor, and particularly not just to mentor young people who are looking to do this work, but pay particular attention to mentoring the person that's going to replace you in your role as a leader someday, because that's going to create sustainability for your effort. If you end up isolating yourself and becoming the person who's solely responsible for that effort, then when you inevitably go away or slow down or age out of the field, then that effort's going to face challenges. So I think it's super important for a seasoned professional to think about grooming their replacements and creating a sustainability in their work that will carry it for a long term.
Okay, and that wraps up our last section of advice. Thank you again to our panelists for giving such genuine, great advice. I'd like to invite all of our panelists to turn on their cameras. Unfortunately, we only have time for one question, and there's going to be a little bit extra couple minutes running over, and this question is open to whoever would like to answer it. Was there ever a situation or challenge that made you question if you wanted to keep pursuing global health?
Can I take that? So I'll start. This is Timmy here. Yes, there were. And I can remember the precise moment. I was living in Ethiopia. I had just gotten to an apartment. I did not know that there was going to be no electricity, so I had no electricity. I had no water. They cut the water. I didn't know how to start a fire, and I didn't know how to speak the local language to ask for help. So that was one of the moments where I was sitting outside. Mosquitoes are starting to swarm, and I'm like, what am I doing here? And that's one of the moments that, as Dr. Rosa was talking about, you're going to have moments that are going to challenge you physically, emotionally, mentally, and you're going to wonder, why am I doing it? Am I helping anybody? Is this really making a difference? And I've had those moments consistently, and on the other side of them, I'm always a better person. I've always grown exponentially, but there have been many times where I've wondered about whether or not the work we're doing is changing things. That's it.
Okay. Yeah. Dr. DeRosa or Sylvie, would you like to answer the question?
Yeah, I mean, I would reinforce that. I think a lot of people who do this work, maybe most or all of the people who do this work, have a similar experience. My first trip to Panama, I got sick the first night down there, and I spent my first night in Panama in a Red Cross office in Chiriquí province near the Costa Rican border, entirely alone because the group was taken to another building to spend the night. And I was up all night, sick and vomiting and fever, and wondering, A, if I was going to get back to the States, and B, if I would ever leave after I got back. But you get through that, and you get through those experiences, and like I was saying before, if you're passionate about the work, you keep doing it. And those things can be galvanizing at the same time that they can be challenging.
Thank you for sharing. And then Sylvie?
Sure. I haven't had necessarily extremely harsh experiences like Timmy had, but or Dr. DeRosa, but I was discouraged, to a certain extent by family members actually. So this might harken back to a previous webinar where you were talking about a challenge that it takes to doing global health work. And even though my family is from Haiti and living here, they're constantly warning me about the dangers of this place that they live and I live. And it's a challenge to be cautious, but also to do enough so that you feel like you're really inhabiting a space. So, with security measures, as Timmy was saying, you might start to feel isolated. You might start to feel like you can't be, necessarily the full expression of yourself. I lived in Oakland before this, and ease of motion, ease of getting what you need, is just incomparable in the U.S. compared to a place like here. I saw some vitamins earlier, and I said, oh yeah, those probably cost like $40 in Haiti. So things are really not easy in terms of getting what you need and moving around and just kind of like living your life. And it's not necessarily a deterrent. I just know, and I keep in my mind that that every single place that I go, people who live there, don't have the option to leave like I do. They don't have the option to pack up their bags and hop on the next flight toward the Bay Area. But that kind of motivates me, that there might be some way in which I can improve the condition for the people here, and yeah, as Dr. Rosa was saying, it does help galvanize you in some ways to see how limited you might be in those countries.
All right. So unfortunately, we didn't have that much time left for questions, but just one last thank you so much to our panelists, Sylvie, Timmy, Dr. DeRosa. Thank you again. And another thank you to our audience for tuning in. This is the last of our series, and I would say that ended well for sure. And again, this will be on our YouTube page, the recording. Please participate in our survey. You will get an email right after this. For more information, please visit our website right here. We have all these social media platforms. Please follow us. Again, thank you to our panelists, and that concludes this webinar. Bye.
Thanks, Angela.
Thanks, everybody.
Thank you. Thanks, everyone.